Hi everybody, my name is Dr. Hilary Booth and I'm a naturopathic doctor, and welcome to my video blog. Today I want to talk about breast cancer prevention. October is Breast Cancer Awareness Month, and a lot of people talk a lot about the treatments options that are available, which is wonderful, but today I really want to focus on breast cancer prevention because there are a lot of things that we can be doing in our day-to-day lives to help to reduce our risk of breast cancer by a lot. So first of all, you need to be aware that 1 in 10 of all new diagnosed cancers are breast cancers. Also that it is the most common cancer in women, both in developed countries and in developing countries, and it accounts for 30% of all cancers in North America. That's a lot. It also is the most common cause of cancer death in North America among women, and it's up to 20% of all cancer-related deaths are breast cancer. So again, it is a very important topic, and it's time to really take a look at your own life and see what you can be doing to prevent this from, hopefully from becoming something that you have to battle in your own life. So first of all, some of the risk factors that are huge for breast cancer some of them were really surprising to me as well when I was looking them up. So having no children or no children after 30 years of age, having children after 30 years of age, or not breastfeeding. So if you're in your 20s, like I am, maybe something to consider is having children at a younger age. Lack of exercise, cigarette smoking, having less than 2 bowel movements per week is a major risk factor. Weighing more than 154 pounds, that's a really specific number, being over 5'6", and having a BMI of over 28. Which in Canadian standards is not overweight, but in American standards that's considered, in Canadian standards that is overweight, but in American standards that's a normal weight. So something else to consider. If you have a mother or sister with breast cancer, or any relative with ovarian or endometrial cancer, a brother or a father with prostate cancer, also huge risk factors. If you're fair-skinned like me, if you have allergies or chronic inflammation, if you have a history of strep throat, of mono, that's Epstein-Barr virus, of HPV, or of being on antibiotics, if you have hypothyroidism, if you have more than 3 alcoholic beverages per week, if you dye your hair, if you have dental issues such as mercury fillings or having root canals, if you wear tight bras, if you sleep with any light in your room, and if you're on the birth control pill before the age of 20 or for more than 5 years before the age of 35. So I hope this gets you thinking here. This probably captures quite a few people out there who fall under those major risk categories that are often not thought about or talked about with regard to breast cancer. So I want to give you my top 6 tips. These are really simple things that you can do to majorly change your risk for breast cancer. The first tip that I have is to change your diet. This is always the foundation of everything that I say, but it is true. You need at least 45 grams of fiber per day in your diet. So that's from legumes, from veggies, from chia, hemp, and flax seeds. Those are all wonderful. You need to reduce your intake of red meats, of processed foods, of sugars, and of dairy. So you can switch it up. You can have lots more fish, lots more chicken. Try and buy free-range organic grass-fed. That's the best kind. Lentils, beans, veggies, quinoa, tofu, whatever you like. Just really try and modify that diet. 2 tablespoons of flax seeds per day is a major thing that you can do that's very simple to reduce your risk of breast cancer, because it does modulate the amount of estrogen in your body, so it will bring those levels down if you have too much, and it'll kind of raise them up if you don't have enough, which is really cool. So again, 2 tablespoons of ground flaxseed. This needs to be freshly ground, so do it at home. Buy the flax seeds. Get a little coffee grinder or something like that and grind it up. I do a couple days at a time. I put it in the fridge in a sealed container, and then you can use that for a few days and just keep doing that. It can go rancid if you leave it out of the fridge, so don't do that. Eat tofu, soy, miso soup. All these things, again, are modulators of estrogen in your body, so they do a similar thing to flax. So have that at least once a week. My next tip for you is to get adequate amounts of vitamin D. So in the summer, this means 15 minutes. That's it. That's all it takes of sun exposure on the arms and legs per day. If you're not getting that, you want to consider doing vitamin D drops. These are a really cheap supplement that you can get, and it's really effective. You want to do about 2,000 to 4,000 IUs of vitamin D per day. You can get your levels checked if you'd like, but you can just, most people are deficient in vitamin D, especially in the Northern Hemisphere, so go ahead and do that. it can reduce your risk of death from breast cancer by 50% if you have adequate amounts of vitamin D in your body, and prevents approximately 58,000 new cases of breast cancer each year, and actually about 49,000 new instances of colon cancer each year. So vitamin D is awesome. It's easy. Please do it. My next tip is to do a detox. 1 detox per year, that's great, that's all it takes. If you want to do more than that, that's also wonderful. But please talk to your naturopathic doctor about the type of detox that's best for you. There are liver cleanses and colon cleanses, there are lymph drainage ones you do, heavy metal detoxes. All of them are going to be specific to your personal needs. So you can also watch my video blog on detoxes for more information about that. My next tip for you is to exercise for 40 minutes per day, or for a total of 4 hours per week. These are pretty low numbers in sort of the grand scheme of things, but that's all you need to mitigate your breast cancer risk by 30 to 40%. That's huge. So exercise is obviously important for all the reasons that we always kind of think about for your overall health, but I wanted to draw your attention to something new, something different that you probably don't know if you're not a healthcare professional. But I want to talk about lymph. So lymph is what carries your proteins and fats and your immune system soldiers and your bacteria around your body. It originates in the gut and it circulates through the body and kind of comes all the way up through these chains of lymphatic drainage tissues that are present just under the skin. Now, this lymph circulation is really important to breast health because there is a lot of lymphatic tissue that's underneath the breast tissue and also sort of around the breast area. Now, lymphatic drainage is really important to preventing breast cancer. So exercise, this is where it all ties in, exercise is important for promoting lymphatic flow. Now, your heart pumps your blood throughout your body. So you know that your blood has the circulation that's caused by the heart pumping. Now, the lymph system doesn't have a heart. There's no pump for the lymphatic system around your body. So the way that your lymphatics actually move around your body is by muscle contractions. So when you exercise, even if it's just going for a walk or picking up your groceries, whatever you're doing, when you flex those muscles, the contractions actually help to push along the lymphatic flow and help to promote lymphatic drainage. So 40 minutes of exercise per day or 4 hours per week will majorly help act as that pump like your heart would for your blood for your lymphatic flow. So I hope you learned something new about that today. My next tip for you, number 5, is to avoid xenoestrogens. Now, xenoestrogens are present in our environment. Basically, they are synthetic, they're chemicals that our body picks up and thinks that it's estrogen. So your body has an overload of estrogen in it, but a lot of it isn't naturally made estrogen. It's actually these xenoestrogens that are having the effect. And again, we talked about that high estrogen is a risk factor for breast cancer. So, to avoid xenoestrogens, no plastic water bottles. I will not stop saying that until everybody's done with plastic water bottles. No plastic water bottles, no plastic Tupperware, nothing hot in anything plastic. This includes things like takeout containers and Tupperware and a lot of times your coffee cups, those kinds of things. Eating organic, free-range, wild-caught meats that are grass-fed and hormone-free are very important. Using organic cleaners and cleaning solvents in your house. You can just use vinegar and baking soda. It's equally as effective as your regular cleaning products and don't have xenoestrogens in them. Please avoid anything with chlorine in it. Your body picks that up and thinks of it as an estrogen. So that can increase your risk for breast cancer. And lastly, switch to natural shampoos and conditioners and soaps and all these kinds of things so that, again, those all have different plastics and xenoestrogens in them, and those are going to be absorbed through your skin and into your body, and they're going to cause major disruptions to your hormonal pathways. So I have one more tip for you, and this is tip number 6. It is to perform self-breast exams. Now, your MDs right now are actually being instructed to not do breast exams on their patients and to tell you not to do self-breast exams at home. This is a point of major contention. Personally, so with MDs, or the way that they're thinking about it is that people do find lumps all the time, and these can be quite normal. But it does cause a lot of anxiety in patients, and it causes unnecessary testing, which I absolutely get. But to me, the risk of having breast cancer and not knowing about it completely outweighs the risk of having some anxiety that there's a lump in your breast. So I am all for self-breast exams if you do them properly. So you do them at the same time every single month, or if you want, you can do them at the same time every week. So Friday morning in the shower when you wake up before you go to work, every single Friday. If you're going to do it like that, stick to it. After a while, you get used to how your breasts feel and what's normal for your breasts. Now, something to look out for is that fibrocystic breasts are very common, and this is normal. Basically, you feel little lumps under the skin that are kind of like pea-shaped things. They're movable, they're kind of squishy, and you can also feel little ropey kind of things underneath the skin. And these are sort of the fibro part of the fibrocystic breasts. Again, this is all completely normal, and you'll notice that will change and shift over the month with your cycle. Now, if you feel something that's hard, like a rock, and that is not movable underneath the skin, that is what we're looking for as a risk for breast cancer. You need to go have that checked out by your doctor immediately if you feel something like that. Also, if that's not changing with the cycle, that's another major risk factor. And if it is something that's growing over time, then that's something, again, you need to be checking out. Now, you should take your time with these self-breast exams. It should take between 2 and 5 minutes per breast, depending on how much tissue you have there. You need to go all the way up into the armpit, like right into the middle of the armpit. You need to come all the way across to the center of the chest, and you need to come down a lot further than you would think your breast is, because the breast tissue underneath the skin actually is a lot larger than what we would perceive as being the breast itself. So you also need to be feeling in a superficial level, a middle level, and a deep level in order to kind of cover all that area and make sure that you're overlapping where you're feeling so that you don't miss anything. And I recommend keeping a journal of where you find any abnormalities, any cystic feelings, any fibro kind of feelings underneath the skin, and whether or not you are feeling anything that's hard and not movable and doesn't change with your cycle that you need to speak with your doctor about. Okay, so those are my 6 tips for preventing breast cancer. If you have any questions at all, please feel free to contact me on my website at hillarybooth.com or send me a Facebook message on my Facebook page. You can also visit our website at drshaunadaru.com to book an appointment with me there, and I'd be happy to come up with a breast cancer prevention plan that is specific for you. Please also note that I am still doing free seminars, so if you have a book club or an office or a small group of friends and you'd like me to come and speak to you, please let me know and I'd be happy to arrange that. Thanks very much for watching, everybody. Have a great week.